So we are here again. So this is the last day of the ENETS meeting. And thank you for being here again. Thank you, Chiara, for joining me today again. And what you may highlight from yesterday evening, afternoon, and today, which are the most interesting sessions for you?
So thank you, Jaume, and welcome also from my side. Yesterday afternoon, I found very interesting a session about surgery with all the different topics from about surgery, for example, radio-guided surgery, and the use of neoadjuvant therapies in surgery. For example, these were very interesting topics. And from my book, I found that artificial intelligence maybe will change our interpret, for example, PET examination, histology, and so on. And some clinical trials with the new radiopharmaceuticals like terbium in the Beta Plus clinical trials. And we have not to forget the session with the nurses about also the way of life, the dietitians, and so on. And I think these are, for my side, the most interesting topics. And what about you, Jaume?
So for me, yesterday we had the two trials reported, one with a chemotherapy for NECs coming from China with new chemotherapy, together with an anti-angiogenic drug. And the other one is an update of a prospective Japanese study, the combination of an mTOR inhibitor and a SSTR analog. This study was initially reported at ASCO GI a few months ago, and here it has been updated. The real results of this study are quite impressive, so responses and the time to progression is quite large. So we need to know more data about this Japanese study, and we will follow the future updates of this study. And today I have been participating in an exchange meeting between the European side and the North American side, so ENETS-NANETS joining meeting. It has been very interesting because we have done a couple of general talks with the new advances in NETs and in NECs. But for me, the most interesting part has been how we may do guidelines and clinical trials all together. We really need to do that in one site in Europe, in one site in the US. We can work together, not in the US only, in North America. So we think that we have several points to join efforts. And I'm pretty sure that in the near future, we will see collaborative clinical trials and guidelines that I hope will facilitate the advances in the NET field.
And do you think there will be some new trials, for example, for more aggressive diseases like NEC?
So this has been my talk.
Yes.
So what's new on neuroendocrine carcinomas?
Yes.
We are already there. So we are having new radiopharmaceuticals, probably against DLL3, also new immunotherapies that may activate the immune system, also targeting the DLL3. So the DLL3 is a protein that is overexpressed in many neuroendocrine carcinomas, so we may take advantage of that. And these are moving to earlier lines. So I'm pretty sure that in the next maybe 2 to 5 years, we will have conclusive results of these new approaches next.
So I think that we are the end of this Congress, and we have seen many important topics. And so I welcome and I hope to see you, all of you, again the next year, again here in Krakow. So, Jaume, see you.
See you, Chiara. It's always a pleasure, and thanks for watching.
Sorry. Thank you.